And welcome to Sugar Talk here on the Talk Station with Dr. K.G. Lucas of Diabetes and Endocrinology Consultants. Good morning, Doctor. How are you?
Good morning. I'm great.
Thanks for being in on this Labor Day Monday. What are we talking about today?
You're not going to ask me about my prop?
Oh, I didn't even see it. Okay, yes. I thought it was a snack. You can leave it.
It's hard to eat it on the radio.
Yes.
An apple. So I brought an apple today.
Mm-hmm.
Not because an apple a day keeps the doctor away, because that's not really true. But this apple reminds me about school. Because you're supposed to bring an apple to your teacher. I don't know if they do that anymore. It's better than bringing chocolates, probably. But the apple reminds me about diabetes school.
Right, okay.
And diabetes school, we've been having those for quite a long time. About twice a year, we have a room in the History Place in Morehead City. And we go over about diabetes. We train people what diabetes is and what they should do and how they should take care of themselves. And I think it's very helpful for people. It's a concentrated period of time that they have plenty of time to ask questions and talk about diabetes and present the material in a complete form. I think a lot of times we get haphazard information. We might read about it a little bit, or we may hear from the doctor for about 2 minutes about diabetes, but it's a way of learning about diabetes.
Right. I know even on this show, I think you have kind of straightened us out about some things about clear delineations of diabetes that I think people thought were pretty vague in the past.
Yeah, and diabetes is a very complicated disease, and it involves a lot of people taking care of themselves. I mean, doing things for themselves. And so the more education you have about how to do it and how to do it right and what you should be doing, it may change your mind about what you're doing. It may help change a few bad habits. That's what we're trying to do, one bad habit at a time. So it's from 8:30 to 12 at the History Places on Saturday, October 10th is the upcoming one.
Okay.
So we're taking reservations now. It's no charge, free, and you just have to call our office to reserve a place.
Is it now again, who is it for? Is it just for people who have diabetes, or?
It's for people with diabetes. A lot of times it's for wives of husbands with diabetes.
Caregivers.
Caregiver.
Right.
Yes, if you can call a wife a caregiver sometimes. But yeah, people that, prepare the food, it'd be nice for them to know what to fix. A lot of people complain about the people preparing food that they don't prepare the right food, and like, well, how would they know what kind of food to prepare? So this is one way. We have a dietitian come, and she talks for about an hour about food and how it's related to the blood sugar. I think a lot of people know how food is related to their blood sugar because they check their blood sugar after eating, and it may be really high for some meals and really good for other meals. So it's good for people with diabetes to come. It's good for people that live with people with diabetes to come, and anybody that worries about their risk of diabetes. So if you don't have diabetes yet, but maybe your parent has it, or both parents have it, or brothers and sisters have it.
Right.
Yeah, and people that have pre-diabetes, have been diagnosed with pre-diabetes. A lot of people don't know what that is, or what they should worry about with that. We go over that. So we go over all what happens with diabetes, how you pretty much can predict whether you're going to get it or not, and then what you do about it.
Now, and as you mentioned for caregivers, because so often, I know it's been my experience about people with diabetes sometimes are in denial about that and about their own care. You've mentioned many times before, oh, well, my sugar wasn't all that bad.
Yeah, denial is a coping mechanism that doesn't quite work well with diabetes, because if you deny diabetes, it's just going to get worse over time, and then you're going to have a lot of symptoms, and it slowly gets worse, and it slowly affects your body. So it's better to find out early, take care of it, and then you don't have to spend as much time worrying about it, that you're just taking care of it and you know what to do. And I think information is a big part of diabetes treatment, because I can't be with you every day telling you what to eat, even though I see you in the grocery store sometimes, looking at your card.
Oh, I hate to run into the doctor in the grocery store.
They look at my card too, so it's okay.
But this is and you're with people obviously who are in the same boat with you.
Yes. Everybody at school, and you learn from them because you learn from their questions. If you don't feel like you want to ask questions, we have plenty of time for questions and concerns that most people have. We go over all the medications for diabetes, because with type 2 diabetes, there's lots of medications, and it's very confusing. Type 1, they're getting so that they have more medicines now that maybe they can choose from besides insulin. So I think it's good. We go over all the research studies that we have, and then we have an area that they can find out more about clinical research program and sign up for research if they want to.
And how about as far as like your own testing? You test your own blood. Do you go over
Yeah, we go over that and why you test and when you test and what the tests mean. We have people there that can test their blood sugar if they feel like they're getting low or don't even know what their blood sugar is. We have people, the nurses there to help check it. We have snacks, healthy snacks.
I think a lot of people are often confused about what they should do if they have low blood sugar or high blood sugar. How do they get it back in line pretty quickly? I mean, if it's something that's more crucial situation.
Well, because of the adrenaline release to try to raise your blood sugar, people just go wild sometimes with treating low blood sugar. So they'll drink, a whole gallon of orange juice, and even though only a fourth of a cup is needed, and then they overtreat it. So overtreating low blood sugar leads to very high blood sugars. So that's what we're trying to deal. We know you're panicked because of the adrenaline that is released, but just stay calm. Drink the small amount of juice, eat a little snack. Try to relax a little bit if you don't feel like it's coming up, and you always check it and see what your blood sugar is doing. So with the meters we have now, they check it very quickly, and you can find out exactly what your blood sugar is. You don't want to overtreat it for sure.
Right, more like the Red Cross snack after you've been given blood.
No, I think they give cookies. Do they still give cookies?
Welcome back to Sugar Talk with Dr. KG and Lucas, brought to you by Diabetes and Endocrinology Consultants, and we're talking about diabetes school. So when is this next one?
So it's October 10th, and it's at the History Place from 8:30 to 12, and we have a break in between, so you don't have to sit there for 3.5 hours. And to sign up, you can go to the website and send us an email. We don't have a sign-up sheet on the website, but you can send us an email and tell us you're interested. We'll put you on the list. There's no charge, and you can come. If you can't come right at 8:30, because that's pretty early on Saturday morning, you might miss my talk, but you can come if you really want to miss my talk. But it'd be good to get there at 8:30. History Place. You can look at the museum for free while you're there, like at breaks and things. So that's nice for some people to do that.
And if you want to call in, you can use the number 222-5700?
Yes.
Okay, and call in.
And just let them know you want to come to diabetes school, and we'll put you on the list.
Okay, October 10th at the History Place in downtown Morehead City. Now, do they have materials they'll end up taking home with them? Is that
usually we'll send the slides like in an email. The PowerPoint slides, so you can easily put in a file if people are interested. I think it's good to take your own notes, so you'll put down what's important to you, because some of the things are not necessarily relevant to you. Some of the medications you might not be on, but the medications you are on, it might be good to take notes, and that way you stay awake.
You say you're going over the different medicines or the different studies that you've been engaged.
Yes,
in,
we
right?
pretty much take diabetes from what is diabetes and how do you treat it, what are the different kinds of diabetes, who's at risk for diabetes. The dietitian goes over the food. We go over the complications of diabetes. So it's a lot of material. And I have a few people that have come, like every diabetes school, like for the past 3 years. I mean, they really come and they learn something different each time. We try to vary the slides a little bit depending on the information that's available.
Well, and people go through stages. So if their diabetes hasn't been well controlled, maybe they're doing a little bit better. So they learn that part.
So it's the first time they learn, they should check their blood sugar and maybe eat right. And then the second part, they learn more sophisticated things about what to do. Or they can ask more questions. Like if they've gotten their sugar well controlled except one time a day, what do they do about that time of day? And so I think it's very helpful no matter what stage you're in, or even if you don't have diabetes, it's helpful to learn about it if you're at risk for it.
Okay, there you go. And again, it's going to be October 10th at the History Place in downtown Morehead City. You can call 252-222-5700. That's 222-5700 if you want to sign up for that. Or go online at beachdoctor.com and send an email through the website for that as well. How long have you been doing these?
Ooh. Well, I've been here 15 years. I've been doing them. I've probably been doing about 10 years.
Do you do one a year, or do you do
two
more?
a year? Usually in the spring and fall. We try not to do it over the holidays, and we try to do it at a reasonable time that the weather's not too nice.
But both of those times are kind of right before big eating times.
Like the April one is before swimsuit season.
Yes.
And the October
And the
one is
Easter
before
chocolate.
all the Halloween and Thanksgiving, all the other holidays that you tend to eat a lot. So we talk about that too.
Mm-hmm. And how to make it through though.
Yes, how to make
periods.
it through. Basically, walking away from the table. That's what you do.
And talking about like weight and BMI and things like that in relation to diabetes, or
yes, weight's very important in diabetes, and we go over that and how to lose weight. And I think that's very helpful for people to know.
Yeah, and again, crucial to that because you're talking about diabetes not as a one-time event, but as a lifelong event.
Yes, and you have to change things in your life, and changing habits over time is hard. That's why you don't want to change everything at once. That's why sometimes weight loss programs that are starvation diets really don't work long term. They only work very short term. And that's not what you're trying to do. You're trying to lose the weight and keep it off.
Okay, again, diabetes and endocrinology consultants and the new diabetes school coming up October 10th. You can go online at beachdoctor.com or call 252-222-5700. We'll see you next Monday.
Okay, bye.